Welcome back. Now we move on to equipment specifications used for mobile imaging. When it comes to focal spot to skin distance, the equipment or the mobile equipment must have a device that limits the focal spot to skin distance. The focal spot to skin distance must not be less than 30 centimeters for mobile equipment. This information can be verified in Safety Code 35 and it's found on page 25 of the Safety Code. Now, how do we control the exposure when it comes to mobile imaging? We have to assess the condition of the patient restraints, the protective aprons, gloves, mobile protective barriers, and other protective devices. And the operator, to protect themselves from unnecessary exposure, should stand at least 3 meters from the X-ray source when the tube is being energized. Once again, to verify, please go to the Safety Code 35. That information is found on page 73. So what are the general requirements and equipment specifications when it comes to fluoroscopy? As you know, fluoroscopy procedures produce the greatest patient radiation exposure rate in X-ray. Now, to minimize patient exposure time whenever possible, we have to limit the size of the fluoroscopy field to include only the area of anatomy that is of clinical interest. The X-ray tube and the image intensifier must be linked together so that the tube can only expose the input phosphor screen. The table is shielded for under-table fluoroscopy to prevent scatter radiation or to minimize it. The X-ray table must have a half-value layer of more than 1 millimeter aluminum equivalent. This also helps reduce dose. There must be a timer present which notifies the technologist that 5 minutes have been reached when exposing the patient. And it is our job to work towards reducing the overall length of the exposure. We have to select the correct technical exposure factors to minimize the amount of radiation received by the patient. We have to ensure that the source to skin distance is no less than 38 centimeters or 15 inches for stationary equipment and no less than 30 centimeters for mobile fluoroscopes. The radiation output of the equipment must also be monitored since the phosphors in the image intensifier age and produce less light over time. With automatic brightness control, the machine automatically turns up the MA and the KV, thereby increasing the radiation levels over time, so we have to keep our eye on that. Use of the last image hold feature is also handy in reducing dose. When it comes to fluoroscopy, we have to monitor the skin dose. If the skin dose received is in the range of 1 to 2 gray, regulations or the U.S. Food and Drug Administration requires that a notation or a note be placed in the patient's record or on the patient's chart. As a radiographer or technologist, it is generally your responsibility to monitor and document the fluoroscopy time. So what are the shielding requirements of an X-ray room? Well, when designing the layout of an X-ray facility, there are a few general recommendations that must be considered. The X-ray room must not be designed without knowing the location and the use of rooms which adjoin that room. Remember, we are shielding against 3 sources of radiation: primary, scatter, and leakage. So we need to know what's going on around the room that we're designing. As is stated in the Safety Code, radiology rooms with stationary X-ray equipment, which can be accessed from public areas, should be equipped with self-closing doors and must be identified with warning signs. The rooms containing the X-ray equipment should be designed to provide adequate working space to the technologist and to allow ease of movement for the patient. Now, no operator should be exposed to more than 0.4 millisievert per week according to the regulations. The X-ray equipment should be positioned in a room in such a way that during the irradiation, no one can enter the room without the knowledge of the technologist. The X-ray beam must always be directed towards an adequately shielded area, and shielding must be constructed to form an unbroken barrier. And if lead is used, it should be adequately supported to prevent any creeping of X-rays through that area. Radiation levels in controlled areas that are occupied by technologists must ensure that no one receives more than the 20 millisievert per year limit. Radiation levels in uncontrolled areas must be such that no one would receive more than 1 millisievert per year. The thickness of the shielding material, such as lead and concrete that is commonly used, to reduce the radiation level in the room to a recommended dose limit, This is determined through calculations. In general, the radiation exposure to individuals will depend primarily on the amount of radiation produced by the source, the distance between the exposed person and the source of radiation, and the amount of time that that individual will spend in the room. Parameters that must be considered for barrier thickness calculation includes things like workloads, so the amount of use, how many patients are x-rayed over a period of a week, and what was the average kV and MAS used for the x-rays taken in that week. We're also looking at occupancy factor. How often is the room occupied, and who spends most of their time in that room? We are looking at use factor. How often is the x-ray beam directed towards a certain point in the room, such as the floor or the door or the ceiling? Is the area behind the barrier, will it be a controlled area or will it be an uncontrolled area? Will it have a primary direct beam going towards that barrier, or will there be a secondary source of radiation going towards that barrier? These are all things considered in the calculation. Here's an example of a workload sheet. This is straight from Safety Code 35, page 20. Here's a good example of how to calculate the workload. This will be included on your final exams, so please practice these types of calculations. Also from the Safety Code 35 on page 20, you will find examples of use factors. So there's a certain value given to a use factor depending on the area. A value of 1 is assigned to a primary barrier, floor of a radiation room, or the wall of the radiation room containing a vertical image receptor, for example. A use factor of a quarter is given to doors and walls of the radiation room that are not routinely exposed to the direct radiation beam. A use factor of 1/16 is given to the ceiling of the radiation room not routinely exposed to direct radiation beam. So as you can see, there are different factors based on where the beam is hitting the room. This is an example of the occupancy factor. And once again, just like with the use factor, there are different values associated with each. The occupancy factor takes into account the time the space behind the barrier is occupied during the work week. So it's occupied maybe half of the time, or 1/8 or 1/40. It's given or assigned a certain value based on its use. The X-ray control area, where people are constantly in that area, like clerical staff or people reading the images, or technologists are hanging out in that area in the control room, that is occupied way more. So it's given a higher value than the parking lot, where you would hardly have any person or people exposed to the area, and so the barrier value is reduced. So here you see the equation that is used for the calculation of primary protective barriers. For the application of protective barriers, the question should always be asked, will the intervening shield between the X-ray tube and the occupied area act as a primary or as a secondary barrier? Will the barrier be required to attenuate direct X-rays or only stray radiation? So for each door, wall, and other barrier in an X-ray room that is provided protection against radiation, the workload, the use factor, and the occupancy factor must be determined, as this will be used in the shielding equation, as you can see in this image. Comprehensive shielding calculations for large radiology facilities should only be performed by individuals with current knowledge of structural shielding design and the acceptable methods of performing these calculations. So for final exams, you do need to know the difference between a secondary and a primary barrier. You do need to know how to calculate workloads. You need to know what use factor and occupancy factor means and what values are associated to them. And you need to know that all of these parameters are essential in the calculation of a shielding device or a wall or a room. Remember that shielding protects X-ray department staff. It protects ourselves, the technologists and the radiographers, the patients, the visitors, the public, and persons working in adjacent or nearby X-ray rooms or facilities. The classroom next door, for example, in the college. When you are working in the mobile room, you know that the room adjacent to that is the respiratory therapy classroom. So that wall has to be shielded correctly to prevent any stray X-ray from moving across to the adjacent room. We always have to consider the type of equipment being used, where the beam is directed towards, and where you are located when the x-rays are being taken. This is all important in ensuring proper protection. So this marks the end of this presentation. Here's a checklist that can be found in Safety Code 35 on page 82. And this sums it up nicely, what is required by the facility and what are the equipment requirements. So you can have a look at that. It is on page 82. I have included some questions here for your review. This is straight from the Medical Radiography Radiation Protection textbook. And here are some calculations I'd like you to review and practice for final exam. And these are the references for this unit. Please do some further reading if you'd like to learn more. So that's it for today, guys. I'm wishing you a great week, and I hope you have a good study week as well, because this is the end of this particular course. If you have any questions or concerns, of course, you know where to find me. Contact me via email or WhatsApp. I'm there for you if you need me. Okay, good luck with the finals.